Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about bonding attachments. And I probably already touched on this in a lot of my other Invisalign or ClearCorrect videos, but I just wanted to go over a few things just as a quick refresher. What do I use to bond attachments? And to be really honest, it really depends on what I have in the office. In general, I mean, you want it to be something translucent, like an incisal shade or a shade that matches the tooth. I usually just use whatever packable composite is sitting around the office that's not in some crazy shade, that's in the B1, B2, A1, A2 shade, or anything that's incisal. Or you can use the composite that's sold by Invisalign that's pretty decent. A lot of times I just use Transbond, which was the kind of semi-packable composite that we used, made by 3M Unitech, I think. That we use for brackets, and it worked just fine. It was the right consistency, but you need to use what works for you. Now, what I can tell you what doesn't work, and I've seen a lot of cases, and to be honest, I started off doing this, is flowable. Well, that's not true. Flowable does work. There's a trick to using flowable. And I kind of don't want to teach you the trick because if you do it wrong, it turns into a huge mess, and it's going to get all over the teeth and in the embrasures, and it's going to be a huge mess to clean up. So you know what? I might make that a separate video another time, but I wouldn't use flowable. It just makes a big mess, and that's possibly what happened here. You can see the attachment, and you can see how the smudge that goes around. That's not how it's supposed to be. You shouldn't have any smudge around the attachments, any of this. It should only be the attachment. So if it happens and if you overfill it, all you got to do is, of course, you want to press down hard, when you're placing it. It's going to smush out, and then just get one tapered carbide bar, skinny tapered carbide bar. And I forgot all my burr names. It's not a 557. It's whatever that skinny tapered diamond carbide is. And just go around and clean up the flash. Sometimes you can just do it with a scaler too, but sometimes it pulls off the whole thing. So I recommend just the skinny tapered carbide and just go around and clean it up. Another cool trick that you can use is you can buy a black light from Amazon for like $7. I bought one and did a demo. And if you want to check it out, you can, oh goodness, how are you going to find that video? Just go into my YouTube, which is StraightSmile Solutions YouTube, not your YouTube, my YouTube, and put in Invisalign attachments, and it will be there. It'll be like tips on removing flash from Invisalign attachments or something like that. And you'll see how I demoed using a $7 black light from Amazon to be able to recognize all the extra flash so you can see it better if you aren't able to see it. But usually if you just use an Explorer and just scratch at it, you'll catch it around the edges. It's not that hard. So, but the trick to the black light is you have to be in a pitch dark black room, which rarely you are in a dental office, that you can turn off all the lights completely and make it pitch dark, unless you're in like a surgical suite or something like that, or a pedo suite. But yeah, you got to get all the flash off. If you leave flash on, these things are not going to seat properly. If they don't seat properly, you're not going to get the proper movements, which means 100% chance you're doing revisions, refinements. It's really, really important to be super accurate at this step, and to make sure you don't underfill it. If you underfill it, you're going to get voids. If you do voids, it's not going to move right? And it's also going to be a plaque trap. If you overfill it, it's actually worse than underfilling it, to be really honest. That is 100% not seating right. You're going to get either rocking, or you're going to have tracking issues right from the get-go, and you're 100% having a revision or refinement. Plus, it looks nasty. Looks like food. So just got to practice. And in most states, the assistant will preload the tray. You can even do this ahead of time, hours, if not days ahead of time, if you keep it in one of those really, and I have some other videos on that. You can buy these light-proof containers. Light-proof, air-proof, smell-proof. You can buy these at any dispensary. If you are in any state that has cannabis dispensaries, they definitely have them there. They're black. They know exactly what you're talking about. But you can also buy them on Amazon. Just light-proof, air-proof, blackout containers is kind of what you call it. And you can fill them in a dark room real fast, throw them in the container, close them up with the patient's name on it, and it's ready to go. As long as it's light-proof and air-proof, it'll be fine. It won't set. And then, your assistant can take their time, his or her time, or their time, to pack it really, really well and accurately, outside patient hours, or when patients, things are slow, you can do it the day before. I mean, the only risk is if you do it too slow or in a room with too much light and it sets, well, you're going to be in some trouble. You're going to have to reorder the attachment template. So you got to be really fast, really accurate. Do it in a pretty dark room. And then put it in the light-proof, airproof container with the patient's name on it. And orthodontists do this all the time. We do this with indirect bonding. We preload stuff and get it ready to go. And then we just put it on the patient's tray so it's ready to go. Saves super lot of time. And then you won't be rushing. If you're not rushing, you're going to do a better job at putting this on. If you do a better job, teeth are going to move more properly, are going to move properly. And hopefully you won't have a revision or a refinement. But yes, packable composite in a good shade. All right, thanks.